A young woman doctor allegedly died by suicide in Maharashtra's Satara district, naming a police officer and another person for rape, sexual, and mental harassment in an alleged handwritten note on her palm. While the police are now searching for the absconding accused, the circumstances of the case have led to several questions: whether there was any political pressure on the young doctor, whether the police failed to address her concerns and complaints despite her constant follow ups. The young doctors in Maharashtra have today protested by tying black ribbons, seeking strict action against the accused. Hello and welcome to this week's Pulse Maharashtra with me, Vinaya Deshpande. I'm the Maharashtra Chief of Bureau of the Hindu, and this week we're going to discuss about the issues and the concerns that have been raised by a young woman doctor's alleged death by suicide. And to discuss this issue with me, I have today a prominent national and international voice working for suicide prevention, Dr. Soumitra Pathare, who's the director of Center for Mental Health, Law and Policy, and who's a consultant psychiatrist. Sir, thank you so much for speaking with the Hindu and for your valuable time. It's especially important for us because you have a record of providing technical assistance for health and family welfare, government of India in drafting India's new mental health care act as well. Not just in India but also abroad, you have helped in drafting mental health policies and have served as WHO consultant in many low and middle income countries. Thank you so much for your precious time for the Hindu. And to begin the show, I want to ask you, with respect to this particular case, it has not just tarnished the image of Maharashtra but has raised several pertinent questions with respect to the alleged pressures that the young doctor faced. The kind of media reports that have been coming up suggest that she had been following up on the complaints that she had raised with the alleged interference in her work, and that was probably somewhere that she felt frustrated. The family has spoken vociferously against it, saying that there was no action despite her repeated complaints. What does this entire case look to you as?
First of all, thank you, Vinay, for asking me to join the show. I think I mean this is one of these terrible cases that catches everyone's attention. But I think it's also important for us to not forget that this is a repeative pattern of things happening. Look, let's just take medical students for example, or medical or doctors for example. We had the Payal Tadvi case. In that particular case too, the issue was harassment and abuse. In this particular case, again, it is an issue of harassment and abuse. And so clearly the causes of harassment might be different. In that case, it was alleged to be caste related issues. In this case, it's sexual abuse and harassment from people in authority. But this is a recurring pattern of behavior that seems to be happening. uh, if you look at the data, for example, then we know that medical professionals, especially doctors, and particularly young doctors, actually have one of the highest rates of suicide across the world. So that's something that is very well known, and that is something that we've seen in our own country. The real challenge actually is that we have not actually addressed these kind of systemic and structural issues that underline the suicide. So, for example, the issue of the harassment that happens to doctors, the issue of inhuman working hours. I mean, we all, when I was a junior doctor many decades ago, the situation was particularly the same. It was, you have junior doctors working 80 hours, 90 hours a week, in very poor working conditions. The accommodation in public hospitals for junior doctors is particularly woeful, even in cities like Mumbai, and maybe something that you should do at some stage and look at how they have to be accommodated in those places. And along with that, they face harassment from two ends. One is obviously, in this case, for example, the harassment from authority figures, such as, say, the police. But there's also another set of harassment that doctors face, which is the issue of harassment that comes from patients, for example. Very often people are quite upset, and rightfully so, because the medical system or the hospital system does not meet their needs. And the doctors tend to be the front end of it, so they face harassment, infrequent violence, and when the doctors actually have no control over how that can be done. So I do think that, I hope that at some stage we will move away from just an outrage about the most recent incident of a suicide by a young doctor, to actually, as a society and as policy, actually start looking at what are these issues that are happening repeatedly and need to be addressed. A suicide is usually the tip of the iceberg. So if there is, if you have these issues, then there's an even bigger iceberg underwater, which we are not addressing at the moment. So I do think that we should really be using these kind of opportunities to saying, okay, how can we reform our system now? What the police should be doing, and how the police should reform their own system, is for the police to know. I wouldn't want to get into that, because I'm not a expert on police reforms, for example. But as far as suicide is concerned, I do think that we already know quite a bit, and so those issues can be addressed, and we need to be making those efforts to address those issues. But I don't
You
see that
saying
happening.
that, issues need to be addressed. Nothing much seems to be done in this. You've said quite rightly that this is the tip of the iceberg. There's a much larger issue that has gone unaddressed. The government says helplines have been formed for the doctors for seeking redressal. You have pointed out that the doctor is at the receiving end from both the sides, as as someone who faces the patients, as someone who's a representative of the crumbling health infrastructure, and as someone who faces the flack from within the system, may it be the police, may it be the administration, may it be the political pressure when it comes to criminal medical issues. So it's such a complex issue, really, which can possibly not be addressed only by putting helplines in place, though there are several issues with the helplines themselves which have been put in place. So let us just go threadbare, one thing at a time, looking at this case, looking at the external pressure that doctors allegedly seem to face from the police, from the political or the administrative system. Young doctors who have just been out of their graduation, who have already worked really hard through the years to get where they are, when they are faced with such systemic challenges, what are the safeguards that should be put in place to make sure that that doesn't happen?
I mean, it's not just a matter of safeguards, Vinaya. I think really we need to look at our healthcare system from top to bottom, in a way. A lot of this, as you said very very rightly, a lot of these problems arise from a health system which is falling apart at the margins, so as to speak. And so, the lack of investment in our public health system over decades now is what we are seeing the results of that. Plus, this is accompanied by a sense that we do not really want to invest in our public health system. I have always felt that our public health system needs to really take a holistic approach and not look at public health purely as a provision of hospitals and doctors. And that we are really not doing at all. So very often, like for example, in many places, including in places like Mumbai, for example, the public hospitals are overburdened and overloaded. Now, hospitals are supposed to be secondary and tertiary care places. If we actually did provide a lot of care at the primary healthcare level, then probably people will not rush to those places, and will be able to do what we should be doing in those hospitals. So I think the issue is really not just about, you can't address the issues for doctors without addressing the problems that plague the system as a whole. And very often what is happening is that the doctors are are becoming the sacrificial lambs in this whole thing. You know, the doctors are at the front end bearing the brunt of trying to hold together a system which is completely falling apart. And particularly that the brunt of all of it is actually falling on the youngest people in the medical fraternity, which tends to be the junior doctors. And so that's something that we've really not addressed. And people forget that junior doctors are not trainee doctors. They're not trainees. They're actually fully qualified doctors. You know, they're there working for maybe their postgraduate examination, for example, but they are fully qualified doctors. So these are not students or trainees. They're actually fully qualified doctors who need to get that kind of respect as well as services and facilities. I mean, very often doctors can't do much if the facilities are poor. You know, what can they do? And if you're expecting them to work 80 and 90 hours a week in very difficult working conditions, where medical facilities are poorly available, and then the public expects them to deliver top-notch, world-class healthcare, I'm afraid it's not going to happen. And so then they are the ones who bear the brunt for it. Along with that, you have to also remember that medical education itself has become extremely expensive over the decades, which means the doctors also have that burden. Many of them have loans in place, for example, education loans. They need to be paying that. They also have to support their families. So junior doctors, particularly, have a multiplicity of problems that they face from all ends. I'm afraid helplines are not the solution. Uh, I'll use an analogy for you to understand. Helplines are like stationing an ambulance on a highway. To say if there's an accident, we can respond very quickly. But you need to actually say what is wrong with the design of your highway that you're getting accidents repeatedly happening at a particular place. So the ambulances are not going to prevent accidents. The ambulances might provide immediate care and provide and support and save a few lives. But we are fundamentally not addressing the issue of prevention. What we are doing with helplines is just trying to paper over that crack by saying, oh, we have a helpline in place. And as you said very correctly, there's also problems with these helplines and their availability and all of that issues. So I really do think that we need to really make an effort to address the underlying causes for why young people in this country are dying at a higher rate. I mean, I don't know if you saw this year's data, but for children under the age of 18, India had a total of something like 786, 84 suicides. And the farmer suicides were 10,786. There was a difference of just two suicides between the number of farmer suicides and the number of children under the age of 18 dying. In any other country, 10,000 suicides under the age of 18 would have created a huge uproar, would have created action happening immediately. But we don't tend to do that. Our reactions are largely, we are only reactive. So we react when there is a suicide. And if it catches public attention, then maybe some little patchwork of band-aid is done to kind of get over that till the next episode. But we are not really making an effort to address those issues that exist, both for children as well as for young people. Young people suicides in India are probably the highest group of suicides in India, and we haven't really done anything about it.
You know, the deeper we dig, clearly the deeper the issues are, which are not addressed in a sufficiently proper manner. While you were talking about the young doctors and how they were taking up so much of burden for a fragile health, public health infrastructure that was crumbling, that wasn't really improving, the other side of the story is also the kind of brazen interference that we see with respect to their discharge of professional duties. How do you see the fact that they do not feel that they are insulated enough from political interference, from police interference, and there is systemic apathy to the concerns that they raise? How does this help someone to discharge their professional duties? And what are the kind of burdens that it puts on these young, talented doctors?
I mean, I would, the blame really lies at two levels for this sad state of affairs. One is obviously with with the administration of these health facilities, for example, and administrators in these health facilities have frequently not supported their own medical personnel within the health facilities, and let them have to face the music, so as to speak. And the other group who bear the real responsibility for it is our policymakers. The reality is that what happens in our hospitals and what happens in our health facilities really depends on the kind of policies that are being made by people who are far removed from where healthcare is being provided. This is in our ministries and in our health departments, that where policies get made, resources get allocated, and the provision of services decided. Unfortunately, health has not really been a priority issue for most governments for most of the times. Health only becomes a priority issue when it becomes a crisis. It's not a priority as something that we should be doing when there isn't a crisis. So we haven't really invested, and this is not a particular government. I think it's a thing that has been going on for many decades. Uh, Governments and policymakers have not invested in health at the way that it should be invested in. There are lots of promises being made, uh, and at the same time, nothing really happens. So we haven't made that investment, both human resource investment as well as financial investments, and that is what brings us to where we are now. And so you have these junior doctors really trying to somehow hold it all together for a system which no longer will hold. And so you can see that they are now facing pressures of different kinds: pressures from patients, pressures from administrators, pressures from their own families, for example, and having to deal with all of that with very little support from within the system and from outside the system. So that's really the challenge that we have. And you're working in a background in which we know that doctors have some of the highest rates of suicides among all professionals. So you have that already there, that this is a particularly vulnerable group to suicide. And then you have these pressures which are impossible to deal with. So it's not surprising that I mean, people get horrified with suicides happening. As someone who works in the suicide prevention field, I'm actually surprised, not by the fact that these suicides happen, but the fact that we only hear so few of these suicides happening. There is so many of those happenings, and a lot of these suicides also don't get reported. Remember, we don't always report all these suicides. Occasionally, a suicide catches media attention because there's something about the suicide which is particularly notable in some sort of way, but it doesn't happen all the time. We did a study that basically for every something close to like every 400 odd suicides, one suicide gets reported by the media. So what you're seeing reported in the media is not all the suicides either. It's very few suicides that get reported. So the problem is huge, and it's much bigger than what we really know about. The challenge really is, how do we convert this into something that will, my question frequently on this has always been, okay, what are we doing now? What are we putting in place now to prevent a recurrence of this episode? That's
That,
really the
yeah,
question that.
that
Yeah,
would really have been my last question. While
yeah,
you have said that, as a society, we are only looking at retribution, but at the
yeah.
same time, let me also take that opportunity to say that, this case serving as an example, what is it that you think should change in order to make sure that the issue itself is addressed?
So there's things that you can do which are immediate, and then there are things that you need to do which might take a bit longer. The immediate things, as for example, the helpline issue. Okay, I think helplines have a role to play, and they should be properly operational and should be staffed with people who are trained for that. Otherwise, they're not going to be much use. The second issue is really to work with the junior doctor fraternity, to work with the junior doctors and to actually address issues. Now, some of these issues can be frequently very local and minor and can be sorted out immediately, whereas some of those issues are probably more systemic. Like for example, the underfunding of the healthcare system. Now, that's not something that can be sorted out immediately by, say, an administrator at a hospital. But I think if we can actually have these conversations, the other thing that this case also highlights, forget the fact that she was a doctor. For a minute, leave that aside, the fact that she was a doctor. But the reality is that sexual abuse, for example, and sexual harassment is a major factor in young people's suicides. Now, again, we haven't really addressed that in a systematic manner. Um so there's a whole bunch of things for us to do, some which are immediate and might be local, some which will take longer and are broader and systematic. There is a national suicide prevention strategy. The government released a national suicide prevention strategy many years ago, 4 or 5 years ago. And that has excellent initiative, excellent interventions that need to be done. Now, we have seen very little action in implementing that. So just even getting down there and saying, let's start implementing a strategy that we've all agreed upon as the bare minimum that government should be doing. So that's something that we could be doing. My concern is that very often the actions get taken are really to just quieten down the outrage. So there's a lot of outrage. You do something for a few days just so that the outrage dies down, and then everyone's back to what they were doing before, without actually having made any systemic change to preventing it. And so that's the sad part of it. These are, a crisis is frequently an opportunity for change. But in India, a crisis is not and does not become an opportunity for change. And we've had repeated such crises, and we've really not done anything about it.
Well, on that sad note, Dr. Soumitra Pathare, the fact that a young life has been snuffed out too early and that it raises several systemic issues that seem to have not been addressed. It's not just about Satara or about Mumbai, but it talks about the larger public health infrastructure and the larger political interference in it. Hopefully, the government listens and hopefully more safeguards will be put in place. On that note, thank you so much for speaking with the Hindu.